Hey guys, Dr. Kalantari here, Sunshine Smiles of Orange County. I just wanted to touch base with you guys and discuss a little bit about smile makeovers. That's kind of one of my favorite things to do in dentistry. It's a lot of fun to just kind of go through the process with the patient and help them to design a life-changing or their dream smile. So I was just going to kind of go through the process of what we go through at our practice to with these patients to kind of help get that right or the dream results. Gone are the days where it's easy to just slap on a few veneers and call it good, because as we've progressed in dentistry, we've realized that everything that we do changes or makes a difference in the mouth, and so we've got to be mindful of that and make sure that we're not making any harmful changes to patients' teeth or to their bite or to their jaw relationship, things like that. So that's obviously the first and foremost. We got to figure out why we are doing what we're doing. Why are we doing a smile makeover? Is it just purely cosmetic? Does the patient have a good bite? Do you have the proper relationship that just putting something kind of covering the front of the tooth to make it more aesthetically pleasing is all you need? And those are kind of the simpler cases, right? Because ultimately we're not changing anything when it comes to the way the teeth come together, the way that relationship is, which is important. But at the same time, sometimes patients have a lot of wear. Sometimes you have a lot of breakdown on the teeth. That is why we have the aesthetic concerns in the first place. And so when that's the case, obviously it's a little more complex, a little more detail that we have to go into in order to ensure that we get an ideal result. And so the first appointment is always consultation, kind of discuss what we see, kind of get a bare bones understanding of what will be involved. And to take some records, some photos, to take some models to kind of really understand the patient's jaw relationship, understand their teeth, and kind of see if we can make their desires on stone in order to be able to replicate it in the mouth. So that's always our first step. And then with the patient, you generally we'll do a wax up at that point. So a wax up is basically a design of the smile in wax on a model. So then that way you can almost see the end results. Begin with the end in mind, right? So we see the end result, we see the way that affects the bite, if we're changing anything on the bite, and then based off of that, we can see if it's something that's feasible, or what we have to be able to do to make that feasible. I like to then present my patients with the option to be able to see the changes in their mouth without actually touching a tooth. And so the way that we do that is we actually do a trial smile. And so what a trial smile is we take that wax up, we basically use a little bit of putty, and we place that in the mouth with some basically some temporary acrylic material, and then kind of I contour to kind of make it how I foresee or perceive the case to be heading. And then the patient can look at it in their own mouth and be able to really hone in on kind of what these changes can give them. And that's really a huge way that we can kind of design these cases without doing anything drastic, right? Because ultimately the last thing that I want to do, and obviously the last thing that you guys as patients want to do, is change something without knowing what's possible, right? I don't ever want to go into something and say, well, we'll see what happens, right? Because that's just not how I do things. And so this really helps us to kind of see the end result, hopefully, and make sure we're on the same page, make sure the patient's as excited with the design as we are. And, it also helps us kind of see if a case is not necessarily as easy as we would hope it would be, or we think it is, by designing it that way. And then if we want to show more tooth or things like that, then we gotta figure out a way to do that, and that sometimes will take other steps, involve some specialists or some other team effort, right? So after the smile design and or the trial smile, if everything's looking perfect and it's kind of how we want it, then we kind of move forward with the course of action of treatment. Now, sometimes speaking of additional treatment, sometimes the teeth are just in the wrong place, right? So one thing that we've really started utilizing in our practice, and it's been really awesome, has been the use of Invisalign to not just move teeth into the ideal position, but move them in the ideal position if we know that we're going to be doing veneers or crowns or whatever it may be. Move them in the right spot first, because if we put them in the right spot, then it just makes the whole case go so much easier, right? We don't have to remove as much tooth structure, because we can put the teeth at the right angulation that it really affords us that ability to just minimize the prep, minimize everything about that veneer or the crown, which is, that's what it's all about, right? Minimally invasive dentistry is kind of our motto. We want to be as conservative as possible, and if we can accomplish that even with a smile design case, then that's the best result. So if we do the Invisalign, and we don't always do it, it just kind of depends on the specific patient's needs, on their wants, on how quickly they want to get the results or what they're trying to accomplish. But if we need to, sometimes we'll incorporate Invisalign and we'll do that. And so once the Invisalign's all done, then comes the actual treatment, the prep date. So at that point we would just design the teeth in a way that will be perfect for the lab to be able to fabricate the restorations, the veneers, and that usually is kind of our longest appointment together, but we obviously try to make it as comfortable as possible for our patients. We got TVs on the ceiling and headphones and whatnot, and take breaks as needed, and serve lunch, and kind of try to make it fun. But that day we're doing all the work, right? We're getting the teeth ready, and once the teeth are ready, we're gonna make some beautiful temporaries to go on to them, so that while the lab does their job, works their magic, then you have something to walk around with. And those temporaries are based off of what we're hoping is the end result, because ultimately it's my goal that any changes we're going to make, or any concerns we have, we address that in the temporary, right? Because the temporary that's easy to fix, right? I can always add a little bit of composite to a temporary and make it a little shape differently, look differently, bulkier, thinner, all these things that you can't necessarily do easily in porcelain, we'll do in the temporary phase. And going back to if there's bite issues, then the temporaries are super important, because we need to make sure that bite's going to work for that patient. Because sometimes if you've collapsed your bite over the course of your lifetime, we have to build you back up. We have to get you back to where's normal, but sometimes the muscles don't love that, right? So our goal is to get you there, in as much of a transitional way as possible. And so when you do get the finals, you're comfortable in that position. Your mouth is happy in that position, so you don't have a big adaptation, a big change. And we also don't have to worry about changing those permanents and removing those, because those are a lot harder to remove than temporaries. So yeah, the temporary phase is huge for me. I really want to design the case in the temporaries, and then once everything's perfect, it's super easy. We just take an impression, send it to the lab, or we take a scan, send it to the lab, and the lab will basically replicate those temporaries into the permanents obviously, we try and make the temporaries as pretty as possible, but the lab, with the real porcelain, it's just, that's when it really shines. That's when it's beautiful. So after that, once we have everything dialed in, the lab does their job, and then they send back the restoration, the case, and usually we pop them on, make sure we all love how it is. Obviously, we're a team in this process, so the patient has to be happy, I have to be happy, and if there's any issues, concerns, we address that, and the lab will address that if it's something that I can't do in the chair. But the end result is, we want to make sure that it's the dream smile or the dream change that you've been hoping for. And so if all goes well, we cement those guys on, and if we need to make some adjustments, of course we make them. But in the end, hopefully you walk out with a beautiful smile and everything that you'd ever hoped. And and we're pretty confident of that because we can make it predictable since we've worked so hard in the temporary phase to get you there. So that's kind of a good breakdown of how a smile makeover works. It's a lot of steps, but we're making a big change too, so we don't necessarily want to rush into it. Just do it one day and come back another day, okay, see you later, kick you out the door. So we really like to spend a lot of time with our patients during these bigger cases because they're important. And we want to make it valuable for you. So anyways, if you guys have any questions, obviously you can hit us up on social, or give us a call at our office, set up a consult. But hopefully that gave you an idea of kind of what to expect, or the way it should, at least we feel it should be when it comes to these super cool makeover cases. So hope you guys have a fantastic day, and talk to you guys later. Bye.